I'm Dr. Eric Belusa, and today on Health Hints we're going to talk to you about a problem that affects roughly 60 to 80% of the population at least one time in their lives, and will account for roughly $50 billion in healthcare expenses this year. We're not talking about the common cold or flu or even cancer or AIDS, but what we are going to talk about is your everyday garden variety of lower back pain. Let me give you a little typical scenario. You bent down, you pick up a little small inanimate object, something very insignificant, and you felt your lower back give out, get quite a lot of spasm out of that. The next day you woke up in severe pain, and then you had to work for 2 or 3 weeks after that in the same amount of pain. Well, this is a very common situation, and you're really not alone. This affects millions of Americans each year, and each one of them differently. And the problem is, most of these situations end up building up for years until they actually manifest as a lower back pain episode. Today on Health Hints, we're going to show you how low back manifests itself and some of the causes of low back pain, as well as ways that you can help prevent it in the future. The main reason that people get hurt is that they don't practice prevention. In our fast-paced society today, people really don't look at their healthy backs as a valued possession. Just realize that by missing work for a week can cost thousands of dollars in lost time, lost productivity, as well as higher insurance premiums for a company that's involved. It's essential that you treat your back like you would treat a highly expensive and sensitive piece of electronic equipment. In fact, that's exactly what your back is, a very technical and highly sensitive piece of machinery. Generally, people who have poor posture or use poor lifting techniques will subject themselves to what we call micro-traumas. Now, these micro-traumas are smaller episodes of low back pain that will actually ultimately lead to a larger episode of low back pain. Therefore, these micro-traumas and other stresses that your back has incurred, along with the possibility of some muscle weakness, will actually predispose you to an injury. And it's usually at a time when your low back is at its weakest, like during work, that an injury could occur, and it usually does. Therefore, preventative measures are very essential at this point. Often in injuries, there are many tissues that are involved. If there's a muscle involvement, what we would usually call that is a strain. When the ligaments are involved, we call that a sprain. Other tissues that can be involved are the disc, and you can have something called a slipped disc, the facet joints, which are your movable joints in your low back, as well as other pathological processes or spinal anomalies. Chiropractors have been talking about prevention for years. They're specialists in the management and diagnosis of lower back pain, as well as other musculoskeletal type injuries. Preventative measures are very essential in preventing a problem from coming back. Here are some things that you can do to avoid back pain. For one, get into the habit of stretching. Just like brushing your teeth, you want to get into the habit of stretching out your low back. Just imagine not brushing your teeth for a week or so. Try to imagine your low back in the same situation. Therefore, it's very essential that you stretch on a daily basis. There are 5 easy stretches to do, and it shouldn't take more than just a few minutes out of your day to do them. I think everybody has 3 or 4 minutes out of the day extra. One thing you can do is you can either do them at work or at home. They're very versatile, and we're going to show you a couple different ways of doing them. The first one is the side bend. What you're going to do is bring your left leg over your right leg, and you're going to put your hands on your hips and bend to the side, just like that. Okay? Make sure you go to a point of comfort that's not too painful. If you start feeling some pain, just continue the stretch. Then you're going to bring your right leg over your left leg, and again, bend to the opposite side there and feel a good stretch in your sides, right in through here. Okay, take it to that nice comfortable position. I want you to do that stretch twice. Okay, and each time you do it, take it a little bit further than the first time and try to increase that stretch a little bit. The next stretch that we're going to do is your rotation. And how you're going to do that is you're going to put your hands behind your hips just like that. You're going to support yourself, lock your pelvis in place, and then rotate to one side, just like that. Rotate to the other side like that. You might even get a couple of releases in there, a couple of clicks, and that's actually perfectly normal, so don't worry about that. Okay. The next one we're going to do is the hamstring stretch, and there's a couple of myths out there. One big thing that they showed you when you were a little kid in gym class was to reach down and touch your toes just like that. You're not going to do that anymore because that puts a lot of stress on your low back when you bend forward like that. So one way of reducing that stress on your low back is to put your leg up on a chair just like this, and then bend forward just like that. You should feel a nice pull in the back of your leg. Another way of really increasing that stretch is to rotate your foot outwards like that, bend down, and then rotate it inwards and bend down, just like that. Okay? Do that on both legs, and again, do it twice. The following stretch after that is bringing your knee up into your chest, just like that. What you'd want to do first is support yourself. So give yourself a nice bit of support there if you can. Bring your knees straight up. Again, do both sides. Okay? And the final one is your quadriceps stretch. Okay? Again, find something to support yourself with and bring your knee, grab onto your ankle and pull your knee right behind your low back, just like that, until you feel a good stretch in the front of your legs. Tip number 2 is to avoid poor posture. Poor posture is probably the #1 reason that people have a lot of stresses on their low back, and it's another way of creating micro-traumas over and over and over again. It's just like your mom told you. Really keep your spine really straight and try not to slouch. If you can't avoid slouching, such as if you have a really soft couch or a soft bed, what you do is you grab a little towel roll, just like one here. Very easy to make. Just tape it around. Grab a towel real tight, tape it around on each side, and place that in your low back right here. Okay, and what that does is when you sit, it keeps your spine straight, helps to keep your shoulders back, keeps everything stress-free. The third tip is using proper lifting techniques. You've heard it before, and you're probably going to hear it again. One thing you want to make sure, of course, is to use your legs when you lift. Bring the object close to your body and check the object to make sure it's not too heavy. When you're lifting as well, you've got to make sure that you're not bending and twisting. Those are 2 of the main reasons why people hurt their low back. Also, be conscientious. When you're doing something in the car, when you get in and out of the car, don't bend or stoop too much. And when you're lifting something like your child out of your car, make sure you're really careful with that and you don't bend and stoop too much. The 4th tip, proper nutrition. One good thing is to avoid fats and simple sugars. Simple sugars tend to rob your muscles of their energy. And if your muscles are fatigued, you tend to have a lot less strength to support your spine. The last tip is proper exercise. Just 30 minutes a day, 3 times a week of walking is plenty enough to lower your body's cholesterol, as well as to increase your muscle tone in your low back. Now, there's some very simple exercises that you can do that will help to reduce low back pain. Some of the lower impact ones that you can do that are easy on your spine are walking, swimming, low impact aerobics, as well as doing some abdominal crunches. Those really help to reduce low back pain there. A couple things you want to make note of are to wear good supportive shoes when you do any kind of exercises, and to make sure that you stretch before and after the exercise to help, again, loosen things up before you get out there. In conclusion, practice prevention. Take the time, slow down, and think about your back before you use it. I'm Dr. Eric Belusa.